I'm going to introduce the last speaker of this session. And way too often, we look at patients with the cancer, and we look at them with two missions in mind. The first mission, obviously, is to save their life. And now, for the last 20 years, we've been talking with the second mission, which is to save their future fertility. But there is much more to that. And therefore, it is with great pleasure that I'm going to be introducing the next speaker, which is an amazing woman, Roberta Lombardi. She's a breast cancer survivor and founder and president of Infinite Strength. She's a nonprofit with a mission of making medical treatment and comfort care cost accessible for the underserved breast cancer patient. She's also creator of a co-founder of and CEO of Infinite Beauty, an intimate apparel brand that makes bras for women who had mastectomy to implant reconstruction. So please welcome Roberta. We are really very, very happy that you've been able to join us, and the stage is yours.
Thank you. When Dr. Patrizio asked me to join you tonight, my first reaction was, why me? Certainly I thought you could have somebody speak to you that maybe the name was more recognizable. But I was talking to somebody in the breast cancer community who said to me, don't worry about why, just give the message that we all need you to send to these physicians. And I take that very seriously. I think probably everybody in this room has been touched by someone in their life that has had breast cancer, a mom, an aunt, a daughter. I myself am no stranger to that. I've had several people in my family that I've lost to this disease and to cancer in general. I lost my father when I was 19 to cancer. So when I found my lump during a breast self-exam, and it was confirmed that I had invasive cancer, my first thought was, okay, I got this, because I've seen what cancer does, so I know about it. I'm going to get it. I'm okay. And then I had a mastectomy and chemotherapy, and it ended up being 14 months of treatment. When treatment was over, I did not recognize myself. I didn't know who I was anymore. Didn't recognize the woman in the mirror. And what I found is that there's one thing that, even though you try as physicians to prepare us, you don't talk about what to expect after you treat us for the disease. You send us off on our way, and as I heard, go live your life, and if you have any abnormal signs, call us. I didn't know how to go live my life anymore. The drugs, really wreaked havoc with my mind. Emotionally, I was pretty shattered. I was plunged into menopause, so I didn't know how to relate to my husband. There was just so much overwhelming sadness in me, on top of mourning my breasts, on top of mourning my hair. Now, one thing kept coming back to me. Thank God I wasn't one of those people that, on top of all this, was financially bankrupt due to this disease. Thank God I could afford all the treatments. I could afford all the comfort care costs, and I wasn't putting my family at risk. But you know what? That was not the case for most of the women that I sat with in the infusion room every week. The thin drape that separates us during infusions doesn't do much, to protect privacy. And the stories that I heard of women not knowing whether they should continue treatment or stop treatment so they could feed their families, so they could go back to work and keep the lights on. That's the norm. And so then I thought, okay, I at least could try to stay positive, right? Because I knew, all right, I'm going to figure out my way through this. And my family's intact. My house is intact. I have a roof over my head. My kids are safe. They're not going to be out on the street. There's food on the table. That's what prompted me to start Infinite Strength. Now we're going to take it one step further. What about the woman who hasn't yet had a chance to have her children, or has not had a chance to complete her family, and she is ridiculously young and she gets a breast cancer diagnosis? She's already perhaps financially disadvantaged, and now she finds out the treatment is going to leave her infertile. What happens to that woman? How does she manage to stay hopeful through everything that cancer throws at her, and then beyond, when she's released from treatment, the drugs start to clear her head, and she realizes she will never fulfill that dream of having a child? Infinite Strength to me represents more than giving a patient money. It's more about giving a patient hope. Because if they know that they have assistance, if they know that they have help to get through this, to make decisions on treatment without worrying about the financial devastation or the financial impact on their families, now we're giving them a little bit of hope to hang on to. We're giving them a little bit of hope that when this is over, there's going to be a chance for them. That's what this means. Because as physicians, you're interested in curing the disease. We're interested in helping somebody stand tall when this disease wants to bring you to your knees. So, I guess what I'm saying to you tonight is I'm now a part of a group too big. My fellow sisters of breast cancer, those of us that are here, those of us that are in the middle of fighting their battle, and those of us that have lost their battle. And I'm asking you as physicians, keep in mind that it's not just treating the disease, it's treating the person. It's addressing as a human being and the needs that they have. And the financial impact of this disease can be devastating. So where we can help, we have to. Because to me, it means better outcomes. So on behalf of my entire sisterhood of breast cancer survivors, I want to thank you for having me tonight. And I'm going to leave you with one question, and that is, will you help us? Will you lend your strength to us? Thank you.